For many years, car crashes have been the leading cause of death by injury in the United States. In 2009, death by drug overdose surpassed it. Drug overdose deaths have more than tripled since 1990, but the leading culprits aren't heroin or cocaine. The Centers for Disease Control and Prevention estimates that more than 16,000 people die each year from overdoses involving prescription painkillers. Many people have conditions that necessitate the use of prescription painkillers. This fact alone puts medical practitioners at the center of this complex problem.
Study done in the United States and in the UK shows that 45% of people on any particular day are suffering from some kind of pain that affects their ability to function. And so for me, I'm stuck with, I've got some pretty effective ways of treating pain, and they have an abuse potential. And so I'm stuck in the middle with how best do I manage these very powerful agents when I've got people who need them and people who are abusing them.
Indiana is one of many states that is addressing this problem through the use of a prescription drug monitoring program. Indiana's PDMP database, called INSPECT, collects data from licensed pharmacies across the state on controlled substances dispensed on an outpatient basis. The users of the data are providers or pharmacists who are managing a patient, or law enforcement conducting an active investigation.
In our state, the INSPECT data, which is the prescription monitoring program, has been really instrumental in helping providers understand the lack of fidelity with some of their patients, that the stories they give are incomplete, and that the information can really inform the decisions both in terms of establishing trust or a lack of it. And so the easier that data is to obtain, the more often that data will be used. The more often it is used, the safer the practice can be.
We've been able to approximate that for every controlled substance that's written in our state, our system is only accessed about 10 to 12% of the time. So that's a huge gap in terms of use of this. So what we're wanting to do ultimately is deliver this. The goal is to deliver this information to 100% of all prescribers in their practice environment so they can make an informed decision and improved quality of care.
In 2012, the Office of the National Coordinator for Health IT and the Substance Abuse and Mental Health Services Administration co-sponsored a pilot study with Regan Streif Institute and Wishard Health Services. The pilot integrated prescription histories from INSPECT with existing electronic records to streamline accessing the information at the point of care.
The one thing that surprised me most of all was the fact that I thought that this tool would prevent me from actually writing prescriptions. A lot of the time it actually validates their story, which I think is equally as helpful, that they truly haven't been to see somebody in over a month, and they truly haven't had access to prescription information in a long time, and so that's helpful as well. Our group is structured such that the clinical staff are pretty much spread between two facilities. The resident staff works between both facilities routinely, but the clinical staff is primarily based at either Wishard or Methodist. As soon as Methodist Hospital found out that Wishard, its sister hospital, had access to this data, I've been hounded emails pretty much weekly as to when they're going to have access to this information.
Having PDMP data at their fingertips can also provide opportunities for intervention. For example, when a woman in her 50s presented to the ER with dental pain, the INSPECT data revealed that she had filled more than 100 prescriptions for narcotics in the past year. Dr. Lauren Kopp was treating her.
It was immediately evident that she had a problem with narcotics. And so I went back to the room and I took that information with me. The patient initially was pretty upset. I mean, right off the bat, she and probably verging on angry because nobody ever called her out in this way before. But I reassured her that I wasn't in this to be punitive. I was her doctor at that moment, and I really wanted to help her in any way I could. And that's when she kind of changed to being more sad. She was very tearful, but ironically was also very thankful. She kept thanking me for actually bringing this up because nobody had ever done that before. None of her primary doctor, none of the other prescribers had. So I discussed with her my concern for her narcotic addiction. She upfront said, yes, I'm addicted, and I was actually very upfront about it, and So I provided her with outpatient substance abuse counseling referral and got her hooked up with that. And she, again, was just very thankful that somebody had finally brought this to light. And I do believe that she actually did follow up with that. And hopefully that was an intervention point that changed her life for the better.
This pilot study illustrates the value of having timely access to PDMP data, not just in spotting and curtailing prescription drug abuse, but in helping providers understand the larger story about the patients they treat. By acting collectively to improve PDMP access for practices both large and small, we are one step closer to tackling this important public health problem.